Today's topic is on stress-related diseases. This covers a lot of things which are within what I specialize in, and so I'm going to teach you a lot of things about stress-related diseases which you probably may not know before. So we are focusing on TeraHertz, and TeraHertz waves are electromagnetic spectrum in this range, 0.1 THz to 10 THz, which converted to frequency is 1 trillion frequency of a trillion. So these are very, very potent waves. They're primarily used in telecommunication, where they are better than microwave. So to those of you not familiar, if you are using a 5G phone, your waves is a microwave. And if you're waiting for 6G, 6G will be using terahertz waves. And they can detect substances. So they are useful for military and security applications. And the interesting thing is that every molecule has a fingerprint on the terahertz spectrum. Now this is terribly important, and that's why they're very useful. So there you are. This is the entire electromagnetic spectrum, which spans all the way from radio waves, microwaves, terahertz, infrared, ultraviolet, X-rays, and gamma rays. Now, of course, we know that the waves on this side are very dangerous for human beings because they can cause changes which leads to cancer and all that. But we're not dealing with this. We're dealing on this side. Infrared waves are very safe, as you know, and infrared can heal. There are a lot of things like morning sun, devices like clothing, blankets and everything which are infrared in character. So they are very useful. And saunas are infrared in character. So TeraHertz is here. So TeraHertz shares some of the property with infrared in being able to heal people's problems. So the breakthrough in understanding TeraHertz came in the 1990s when it was demonstrated that it can penetrate. Paintings in the past, there are not enough canvas, so they paint over old paintings. So they have a painting which they were able to look at it using TeraHertz, and they found there was an earlier painting way back in 1771, as well as the name of the artist which do this 1771 painting. So in short, we can now see things that are hidden from view because of TeraHertz. And why we can't use this earlier is because we don't have the means to use TeraHertz before, because of where it is. So here's the spectrum again. This diagram is cleaned up, so these are all the radio waves. We were studying using electronics, and then these are the light waves, visible light, infrared. This was studied using light theory or photonics, and TeraHertz is in between. So nobody knows whether to use electronics or photonics to study. But of course, one thing, the tremendous advance, the scientific advance of China is so great, and they're studying TeraHertz. They use photonic techniques. So you heard of photonic chips, that is chips that use TeraHertz using this technique. So, as I mentioned just now, it's widely used in telecommunication, and the coming 6G will be using TeraHertz. A lot of military and security applications because you can look through whatever. There's a video on YouTube which shows how traditional scanning equipment can't pick up things that people carry underneath their clothes, but TeraHertz is able to do so. So this is very important from a security point of view. You don't want somebody to be carrying a weapon hidden within all their clothes, and that's why security applications are very important. In China, it's used in agriculture to detect drought. How they detect drought is because they use TeraHertz to scan the leaves, and because TeraHertz can detect water, they can detect how much water there are in the leaves. And if the amount of water will get reduced, they know that the drought is coming. So it's used for drought monitoring, pesticide control, and seed and soil monitoring. So in health and science, we use it for two purposes. And it is very safe because it's non-ionizing. It doesn't cause cancer like X-rays and gamma rays. So that's why it's called, the Japanese call it the light of life. Now, TeraHertz heals because of two things. The heat. Because it's an infrared ray, it has this heat and it can penetrate. So, it pushes out toxins, it stimulates water molecules. Then there's a vibrational energy. If you take away the heat, TeraHertz still can heal. It can heal because of the vibration, the frequency. And because of this, it's been used in diagnostic devices as well as therapy devices. Diagnostic devices are devices that can see inside the body, like X-rays or CT scans and MRI. So basically, the vibration can pick up the age of tumors. So they can scan the tumor and they can visualize how big the tumor is, the age of it, whether it has spread beyond a particular organ, as well as bones. And in the bone, TeraHertz can make out the different layers within the bone itself. So that's a very powerful visual tool. It can also be used for therapy, and that's what my talk will be mainly focused on. And the properties of TeraHertz: non-ionizing, so it's safe. It penetrates all non-conducting material, paper, walls, tables, and all that. Anything that is non-conductor of electricity, TeraHertz can see through, and is absorbed by material that are conductors of electricity, of which the most important is water. So it's absorbed by water, as well as by different biological tissues, because biological tissues have water in them. The energy in TeraHertz is equivalent to the kind of energy in very weak bonds, such as van der Waals forces and hydrogen bonds. And because it has energy, and it's a very weak energy, it can cause changes on the shape of the molecules, because these are corresponding to hydrogen bonds. So, because of this, because of the energy, the normal human cells resonate at a particular frequency, and this frequency has been identified as TeraHertz frequency. So because it resonates at the same frequency as TeraHertz, well, it simply means that it can be affected by terahertz waves. Therefore, TeraHertz can regulate biological symptoms by changing the interaction between molecules and so forth, because of this energy involved. Now that's a very, very powerful tool for us to use. So, what are the effects on the human body? It opens up blood vessels. It can vibrate water molecules, and therefore it can activate a lot of cells. It can activate cell organelle. Mitochondria is the factory in the cell that produces all the energy, as well as make all the molecules that you need for life, and it can be activated using TeraHertz. And then hyperactive cells, in inflammation. Of course, if you have an infection or something that is harmful to your body, inflammation helps. But sometimes inflammation causes problems itself. So TeraHertz can normalize these inflammatory cells. And lastly, the important thing is that you can unzip DNA and therefore activate the DNA. So this shows you how TeraHertz can open up the blood vessels, arterioles from the heart, and then the veins go back to the heart. So in the arterioles, this under pressure because the heart pump your blood pressure 120 over 80, all the pressure is there, and when it goes to the tissue, water, nutrients, oxygen, and in the tissues, all the reaction take place. Your body extracts the nutrient, oxygen, and the water, whatever it needs from the blood vessels. And then after that, it goes from the tissue, it goes back into the vein. But the vein has no pressure. It's a low pressure system. And because it's a low pressure system, not all water, not all electrolytes, not all carbon dioxide and waste products enter. So there's a lot of excessive water, there's a lot of excess waste products lying in the tissue, and these are drained with what is known as the lymphatic vessels. Lymph vessel, which bring all these waste products back to the heart to be discharged from the body. So it also regulates inflammatory response. In the blood, there are cells like this. These are inflammatory cells which protects you from infection and other harmful things in the body, and it can regulate that as well. It activates normal cell. In the cell, there's this thing called the mitochondria. These are small microscopic organelles. They perform all this function from making of various amino acids, lipids, and all that, transport. They cause this part of the cell that is no longer in use to die. It controls the quality of the protein. It gives you energy. So the mitochondria is very active, and TeraHertz can activate that in the cell. And TeraHertz can activate this process where normal cells that are no longer any use they initiate this process called apoptosis. Apoptosis means that these cells that have reached the end of their lifespan kill themselves, they break up, and they release bits and pieces with find me, eat me signals. So they are gobbled up by white blood cells that have this function of taking up the waste in the cell. The more important thing is that they can remove microorganisms that are toxic to your body. And this is terribly important, because that was how I discovered TeraHertz. That was during COVID time, and COVID is a virus, if you remember. And a lot of people were having the infection, and we all have to wear masks and, lockdown and all that. And then there were some double-blind trials of TeraHertz for COVID. One trial that I read was that for people with lung infection as a result of COVID, they were scanned using the TeraHertz, and they improved. Wow, I say that's fantastic, and that's how I got interested in TeraHertz. So it can activate DNA, and how it activates DNA is that it unzip the DNA. So there are two purposes when you unzip the DNA. Number one, you produce another pair of DNA, because once you unzip it, you can form another pair next to it. Or you can, the DNA can be activated once it's unzipped, and it can do various things. It can print out the various proteins and whatever molecules you need to make. So this is what it means here. This is an RNA printer. They kind of read the instructions on the DNA and make the proteins, the different molecules that your body needs. Okay? So Today, as I said, we talk about stress-related disorders, and I will cover in the main what most psychiatrists do when they treat you for stress is anxiety, depression, and a major psychosis. And then in the second part, I will cover all the stress disorders that's due to stress, from acute stress disorder to post-traumatic stress, PTSD, residual trauma symptoms, and lastly, burnt out. Now, one thing, this lecture will be different from other kinds of lectures I used to give, where I talk mainly on the psychological part. I will focus on the changes inside the brain, which in the past we don't know much about because we don't have in-depth knowledge of the neuroscience behind all these things. So let's talk about anxiety and depression, which is very common. A lot of people have it. Sometimes it gets so bad that they need treatment from a psychiatrist, and even if they don't see a psychiatrist, then they need the help of special healers who specialize in dealing with their depression or their anxiety. Now, anxiety and depression are two different things. They are not the same. Although there's a lot of overlap in the symptoms, in the causes, and treatments. In this diagram next to it, I highlight the stress normally give rise to anxiety, and anxieties can give rise to depression. So they're all interrelated. And in fact, they affect similar structures inside the brain. And they also involve, depression particularly involves certain chemicals that are used for nerve conduction. And these neurotransmitters, as we call them, are important in giving us depression. You probably have heard of it. The neurotransmitters involved are serotonin, dopamine, and noradrenaline. And anxiety usually comes down if you do certain things or if you take certain medication like tranquilizers. And what do? They target GABA receptors. That's very important because GABA is a receptor that calms down the body and make you calm. Depression usually recover when you have chemicals called antidepressants that block the conduction of these three neurotransmitters. Of course, both conditions can be treated using behavioral techniques or by talking. And meditation can improve these two conditions. So again, this shows the overlap. Depression, anxiety, trembling, heart rate, palpitation, breathing, sweating, muscle tension, nervousness, panic, and so forth. Depression, the more interesting part is loss of interest, low self-esteem, wordlessness, helplessness, and hopelessness. Okay? In between, there are other symptoms that are kind of occur in both: sleep disturbances, agitation, restlessness, difficulty with thinking, concentration, or deciding. So there's a great deal of overlap. Then there is a difference between panic. Panic, at its simplest, a panic attack is the activation of the threat response system. When you're under threat, you heard of it, it's either a flight or fight response. You either run away or you face it and overcome it. So panic attack is the activation of the threat. When you activate your stress symptoms, you begin to have a panic attack, which means your heart beat very fast, you have a lot of fear, anxiety, and this is a stress response. It enables you to face up to whatever that threatens you. A panic disorder is totally different. A panic disorder is when you have panic attack frequently, and each time you have the attack, your threat response system is activated, and you're constantly in a state of alarm. You kind of look out for the panic attacks. That's why panic attacks suffer, because there's recurrent panic attacks. So panic attacks and anxiety is related in the anxiety is part of panic attacks. But anxiety is something that you don't have your heart rate go very fast. Your heart rate may go up, but it doesn't go up in this way where it activates the fight and flight response. So this is part of anxiety. It's considered part of anxiety disorder. So what makes the brain anxious? When you see a threat, right? And what part of the brain detects that there's a threat? Part of the brainstem called the amygdala. Amygdala is here, inside, in the center, in the midbrain. Then there is this part. This part is called the hippocampus. It's not in this slide.
Hello. 今天讲什么？
The hippocampus is a part of the brain that has to do with memory. So everything you feel anxious is stored in the memory system, and every time you face the memory, it will activate this amygdala. Now these are very important things. Amygdala is the one that detects the threat of danger, and the hippocampus is the one that remember that there is danger and that reminds you of where the danger is. Then in the big brain, anterior cingulate gyrus is just next to the midbrain, as well as the prefrontal cortex. These are part of the brain that anticipate and regulate your fear response. So these logical processes is shut down, and this anterior cingulate began to monitor and help you to function, to face up to the threat. So this was involved, and this is how tranquilizers work. This benzodiazepine is a tranquilizer. It sits on the GABA receptor, and we say the GABA receptor when the GABA receptor is there, you feel calm. So benzodiazepine has this effect, make you calm because of that. Depression. What is depression is like? Depression is primarily again in the amygdala and the hippocampus. Okay, it's also in the prefrontal cortex. But the primary part of depression is due, as I said, to the neurotransmitters. So in the normal brain cells, especially in the midbrain, you find that there are normal neurotransmitters, the serotonin, the dopamine and all that function very well. In depression, there is a lack of the neurotransmitter. Somehow, you do not know how to regulate yourself. There's a lack of it. You can't feel happy. You can't feel joy. When you treat with antidepressants, all the neurotransmitters come back, because the antidepressants basically work by blocking the degradation of the neurotransmitter. In other words, the neurotransmitter is always being removed and destroyed. Antidepressants block the destruction of these molecules, and so they accumulate, and that's how you recover. So there you are. The three neurotransmitters: norepinephrine, or noradrenaline, dopamine, and serotonin. So it has different effects. As you can see here, dopamine has to do with motivation, cognition. Norepinephrine has to do with the fight and flight response, anxiety, and all have to do with mood, memory, and sleeping. So, in other words, what I want to show you is that in depression and anxiety, it's not just how you feel, but how you feel is due to what happened inside your brain. What happens inside the various nucleus, especially those in the midbrain, which some people call the emotional brain, because it regulates the emotions of depression and anxiety. what does TeraHertz do as far as this kind of symptoms is concerned? Well, you may like to know, and if you have seen all my previous lectures, you know that TeraHertz has a calming effect on the mind. It alleviates your stress symptoms, it reduces anxiety and depression. And working with animals, they were able to show that it enhances social behavior. It makes you calm enough, it makes you want to connect with people. And these are all due to changes in the chemicals and in the structures that I explained to you just now. It also has a cleansing effect. TeraHertz makes you have less negative thoughts, and it harmonizes the mind's thoughts as well. And it promotes growth of nerves, neuronal growth, and development. So it causes matured and no longer active cells to die. It promotes conduction, like antidepressants, So there are more of the neurotransmitters, and it can actually make things happen at the molecular level. So that's how powerful TeraHertz has on the brain. And you can make use of it if you have anxiety or depression. Now, how about stem cells? Stem cells is pretty powerful. Stem cells has been used for the treatment of this, because stem cells can be converted to nerve cells. And you know that stem cells is particularly used in nervous disorder like strokes and Parkinson's and all that. So when you have anxiety and depression, because it's abnormal, it will attract the stem cells. And particularly in epilepsy. Epilepsy has been shown to improve with stem cell treatment. What's so exciting about that discovery is that the nerve centers involved in epilepsy are also the same nerve centers involved in mental illness. I told you to remember the amygdala and the hippocampus, right? Amygdala and the hippocampus are both involved in epilepsy. And if epilepsy can recover with stem cells, then a lot of the things that we talk about here also can recover, which is what is exciting about this. So it promotes nerve repair, it replaces lost tissue, and it reduces anxiety, particularly with GABA nerves, the nerves that calm you down. As you know, stem cells have this ability to repair all your damaged cells and all your malfunctioning cells, and that's what it does, And currently there are trials being designed to find out whether they are good for treating depression, which is very exciting. And stem cells is able to generate new nerve cells and has an antidepressant effect. So if epilepsy can be successfully treated, I'm very sure that you can use it to treat anxiety and depression. Now, how about a major psychosis? What people call madness. Schizophrenia, which is what madness, talk to themselves, hallucinating, get violent, and what people call manic depressive illness or bipolar illness. So, anti-anxiety and depression, muscular pain and social interaction effects of TeraHertz. So TeraHertz has all these effects of major mental illness. That is important because in both major psychosis, there's a lot of anxiety, there's a lot of depression, and there's a reduced social interaction. And also, dopamine drugs are activated. It's been shown that TeraHertz can decrease the effects, the side effects of dopamine drugs. However, there are no research or case reports online. Effects of TeraHertz on Alzheimer's and brain cancer suggest You probably may know, or you may not know, that TeraHertz have been tried on Alzheimer's and brain cancer. And TeraHertz have shown to have this anti-inflammatory, antioxidant, as well as cause the blood vessels to be that open up, and this contribute to the recovery in these illnesses. So that's what happens as far as TeraHertz is concerned. The plus upregulate, that means increase. All these things, TNF, interleukin C, reactive protein, they increase so that they can be active against all the abnormalities in the cell. Things that are not helpful, carbon now, all these things are downregulated, and same in the mitochondria. So these are real effects. They have been studied and they are found to be true, which is to me very exciting. This slide that I show you, for many years, 15, 20 years ago, I have been a keynote speaker for a lot of drug companies. And one of the things, one of the slides that was given to me to use was that treatment can reverse the damage of depression. In depression, this is a normal cell. This is a cell in a depressed brain. Notice that there are less branches. Notice that the size of the cell is smaller. And in fact, in depression, some of the cells in the hippocampus dies off. So the hippocampus becomes smaller, right? And when you are stressed, glucocorticoids are the stress hormones, cortisol. BDNF stands for brain-derived nerve factor. Nerve factors are associated with stem cells. Okay? So this is normal, this is depressed. The cells either die or shrink in size. Now whatever you do, whether you use psychotherapy, behavioral techniques, or use drugs, or use electrical convulsive therapy or whatever, all these things increase the neurotransmitters. The stress hormones like cortisol get reduced. The nerve factor increases. When the nerve factor increases, it also means one thing, that stem cells are involved. So what you can conclude is that all these things, whether you use drug treatment or electrical treatment or behavioral treatment, stem cells are activated. And what happens when stem cells are activated? The cells become normal. The branches begin to grow. The cells become larger in size. They become normal again. And this is, we know this 20 over years ago. You see how amazing it is that we discover all these things for so long. Acute stress reaction. So, we've talked about the major mental illness, the kind of illness that psychiatrists treat. Now I want to focus on stress. Stress, and particularly now we're talking about how our reaction to stress. There are many kinds of stress, from the usual stress we face day to day in our office, in our relationships or whatever. And then there is also the traumatic stress. Traumatic stress are things that happen to us by accident. They are usually a surprise to us. Like for example, we get in an accident or we fell down, injured ourselves. So some of these accidents, some of this stress are major. They are called life events. Okay? So you got fired from your job, or you lost a friend, or you and your partner, your wife or girlfriend or whatever left you. So you lose something. You lose a job, lose anything. Or you gain something, you win a lottery. So these life events give you to acute stress reaction. After this topic, I will cover something where you face traumatic stress. Traumatic stress is something that gives you trauma. Trauma means you not only see an accident, you witness an accident where somebody got killed, or you get severely injured and has to be hospitalized, or you are involved in a terrorist attack, or in a natural disaster, like for example the tsunami, which happens about 20 odd years ago. So if to a surprise and traumatic event which is not so severe but severe enough that it's called a live event, the live event can be very short, within minutes. It can resolve in a few hours. It's caused by different kinds of trauma, accidents, maiming, disaster, torture, physical assault, domestic violence, all these things. And usually when you face all these events, you have anxiety, irritability, low mood, poor sleep, poor concentration, and so forth. But if you do simple things like exercise, stretching, slow breathing, meditation, all this helps. So, symptoms of acute stress reaction is on this side. Adjustment disorder. What's adjustment disorder? Adjustment disorder are very minor. You need to adapt some change in your environment. You know, like you change your office, you change something. This is much less severe. Feeling sad, depressed, you don't want to talk about it, you avoid, you get nervous, and so forth. When you have acute stress reaction, you got very bad memories that keep interfering, you avoid things, you have negative mood change, you get very aroused and highly reactive, and then things get so bad just you want to just isolate yourself and keep yourself off of all these things, and you can't function normally. Acute stress reaction is not so severe and you should usually go off after some time. Then of course you heard of PTSD, post-traumatic stress disorder. At one time it was very popular. People like to be called to have PTSD. And why? Very simple. Because if you have PTSD, you can get compensation. You can claim from insurance or whatever, especially in the US. So everybody likes to have PTSD. They can get some money, monetary reward. And indeed it was so. But of course some of this turned out not to be PTSD. But PTSD, there is a real PTSD, and I'll show you. This disorder is a result of shocking, scaring, or dangerous reaction. So because of the fight or flight, leads to fear and avoidance. And because in a tsunami, for example, those victims who face a tsunami, they keep having repeated thoughts of the waves coming at them. You know? This is what they call flashbacks, thoughts of the thing. Or if somebody had been raped or physically assaulted, they keep reminding themselves these thoughts of what happened during the assault. Are called flashbacks, nightmares, anxieties, and recurring thoughts about the past trauma. If you are the direct victim of the traumatic stress, of course you feel it, but sometimes even if you are a witness to that, you can also get PTSD. Some people, even by watching the news and hearing the news about the traumatic event, can also develop PTSD. So symptoms can be so bad that you prevent normal functioning and you have difficulty adjusting to a normal life. So some things affects the entire community, like I say the tsunami, or a disaster like earthquake. So if it affects the community, the degree of PTSD is much milder. Why is much milder? Because everybody affected. So you have a lot of shared feeling together with the community. So it's much less severe. But if you alone are affected, as in a road traffic accident, a severe one, or you got assaulted, or got robbed, or got raped, it is much more severe. So That's why individual victims of rape, accidents, violence tend to be more severe and sometimes much harder to treat. So PTSD symptoms are divided into 4 groups. First, the thoughts. Thoughts, memories of what happened to you during the trauma. So you get repeated unwanted memories. Keep troubling you. Then there's avoidance. You don't want to talk about it. And if it's an accident, you want to avoid the place where the accident occurred. You want to avoid anything to do that may help you to recall the psychological trauma. And then there's arousal. In other words, there's a lot of stress and anxiety reaction. So you have difficulty falling asleep. You may have panic attacks. You may have fast breathing. All the symptoms. And therefore, because of heightened arousal, you look for means to try and calm yourself down. You try and do things to calm yourself down. And if you hear stories of people who have PTSD, like the famous singer or whatever, famous singer or writer, they run out into a forest and try and calm themselves down with that. And there also changes in thoughts and feelings. So there's a lot of interest, avoid friends, isolate themselves, solitary activity. So I think if all of us were to look back on our past, we can remember something that happened in our lives where we have been traumatized, where we face something that is very stressful, and 70% of people would have at least one traumatic event in their life. 1 in 13 will develop PTSD. 1 in 13 is quite a lot, isn't it? It's less than 10%. Huh? World Trade, the disaster in New York many years back, World Trade Center disaster, the rate was about 10-11%. 20% will develop PTSD, and so that's your PTSD rates among traumatic injury, 20%. These are all the various percentages. These percentages may seem small, but these are all the movies that have PTSD as the main thing. All this, Deer Hunter especially, out in the open, can't function at all. And if you know all these movies, you know that the main character in these movies all suffer from PTSD. Why? Partly because of the Vietnam War, because USA got into wars in all kinds of places, Vietnam, Iraq, all kinds of places. So a lot of their soldiers come back home with PTSD. And that's why PTSD is an illness that the insurance company will pay for. However, if you are not diagnosed as PTSD, it does not mean that you're totally free from symptoms, because there's such a thing called residual PTSD. So it doesn't matter whether you receive treatment or not. It doesn't matter whether you're PTSD or not. If you've gone through trauma, it is believed that 50 to 60% who have gone through trauma will have some degree of residual PTSD. What do you mean by PTSD? That means they have some intrusive thoughts, they may have flashback, they may have some anxiety, fears, panic, and these symptoms lead to loss of confidence, hesitation, and fearful of change. So they don't have PTSD, they have no anxiety, they have negative thoughts, and because of their fears and their anxiety, often these people end up working by themselves. They're usually entrepreneurs, freelancers, and those who are socially isolated. And a lot of entrepreneurs, they dare not do things right because they fear. There's a fear, there's a loss of confidence, they have negative thoughts, what if I fail? And they have experienced traumatic stress, they're afraid of failure. So a lot of these are a part of PTSD. And they can be treated. And this is much more common. And especially in trades where they can work independently and don't have to relate to people, it is very common indeed. And so therefore, this is very, very important. 60–70% of victims. And if 70% of people have at least one traumatic event in their life at some point in time, 50–60% of that is almost just below half, isn't it? So that's how common it is. And in fact, if you look at people who are practitioners in EMDR, EFT, and all these different psychotherapy techniques that help to treat PTSD, you will realize that a lot of people, maybe in their early life, have been abused by their parents. I have treated somebody who is a professional, runs his own small little business. When he came to see me because he has problems with his wife, and then later on, as he learned to trust in me, he began to tell me stories about how his parents divorced. His mother used to abuse his father, and mother now abuses him, and he seeks his father's company because the father liked music and play with the guitar, so he has a great time with the father playing guitar. And because the mother said father is so bad, so bad, so bad, he dare not tell his mother about that. And mother used to abuse him physically and later emotionally. So when he married his wife, his marriage cannot work. Then he told me that he frequently went engaged the services of escorts, where he get the escort to abuse him, beat him up. And so I was treating him for this abuse. The amazing thing was that one day everything fell in place. So the session after he told me about getting escorts to beat him up, now that he's spoken about it, we can talk freely about it, about how he found comfort in the father, how his mother abuses him. And then I say, you can take charge of your own life. And suddenly everything falls in place. And you should see the dramatic change at the very moment in real time. You can see suddenly he was able to grasp his freedom. And suddenly there's a joy, there's a happiness that he found himself. So it's very dramatic. And this is what is called the residual symptoms. He can function, he can run a business. But he has all these fears inside him, which he dare not tell people because it's so shameful. And unfortunately, this is true. So, but I must also tell you that if the PTSD is very severe, they may need medical treatment or they may need hospitalization. And I've seen several. I've seen a patient who has been raped multiple times, including the time when she seek help. Some of the professionals who help her end up raping her. So it was a terrible, terrible tragedy where everybody she knew raped her. And she worked for a professional as a staff. She told her boss, if you care for me, if you like me, please have sex with me. Because that is the only means she knows of how people transmit their liking of her, by having sex with her. So she was for a long time on medication. But if they are not on medication, you help them to overcome it. And there are many specialized techniques. I'm trained in hypnosis. Initially I used hypnosis. Later I got certified in EMDR and EFT, emotional freedom technique. I used these as well. But I use different aspects of stress inoculation as well as exposure. With proper treatment, these symptoms go away. The outcome is post-trauma growth. So, post-trauma growth, that means after PTSD, you overcome the PTSD and you become normal again. This graph illustrates very well. Let's say you are normal and then you are affected by PTSD, you go down. If you have PTSD, you're down here. You succumb to PTSD. If you survive and still have symptoms, that's where you are. If you survive and become normal, you get back to this. You recover, you get back to this level. That is being resilient. But the best part of all is that sometimes after psychological trauma, after you recover, you become even better. You thrive. Now, this is post-trauma growth. That the psychological trauma becomes a breakthrough to greater things. One patient I know who went through psychological trauma improved. She finds new meaning for her life and she becomes an advocate for the trauma that she suffered. So she now devotes her life to helping people. She's still working in her job as a volunteer. She helps a lot of people and she becomes a blessing to a lot of people. This lady that I told you about, who suffered from repeated sexual abuse and rape, she eventually recovered. The interesting thing was that her recovery took place on a very significant date. And when she recovered, her personality becomes a very rich personality that is able to help people, and she helped a lot of people. She has 3 lovely daughters which have overcome the effect of the psychological trauma, and therefore they contribute significantly to the community and to the church to which they are members. So this post-trauma growth is new. There is a change. There is a value placed on small things in life. There's a change in perspective in their religious or their spiritual outlook. There's improved relationships. There's new possibilities for life, greater appreciation for life, a greater compassion, and this for not only greater compassion, there is a greater sense of gratitude. They're able to embrace love and joy. And these 4 qualities is what makes the difference between a life lived with meaning and a life without meaning. Compassion, gratitude, love and joy. This is post-trauma growth. So, therapy for PTSD, there are different kinds of therapy, and depending on who you go to, you still can get healed. Of course, a lot of people who do exposure therapy and the emotional freedom technique are not professionals. They are lay people who learn the technique and help others. Fine, there is nothing wrong with that. But these lay people who get themselves trained to help others with psychological trauma, because it's so common, they are not able to handle difficult cases. And so there's a limit to how they can help. Nonetheless, I think they are doing a good job. My only wish for these people who are not professionals is that they must know when to refer for professional treatment, because that's what is needed sometimes. So we talk so much about PTSD. What happens to the brain in PTSD? The changes in the brain are mainly in the amygdala, which is now overactive. Amygdala is a stress and flight center in the brain. Hippocampus is where the memory is. In PTSD, the hippocampus is reduced in size because you don't want to remember anything. You only want to remember that you must be safe. So anything that reminds him of the trauma, they will avoid. That's why it's small in size. Prefrontal cortex, the part of the brain that's to do with thinking, decision making, memory and impulse control are reduced. There's reduced signaling between hippocampus and emotional signaling. There's reduced signaling between amygdala and dominant mode network. So what it means is that parts of your brain that normally talk to each other to face normal life, they are not communicating because your normal life is reduced. So in the movies about PTSD, that's what happened. Their life is very narrow, very constricted, very isolated. So they are, as far as the brain function is concerned, they are reduced processing speed, reduced learning, memory, and executive function. Because why? They cannot stay away from the anxiety-provoking stimuli of their anxious thoughts. It's a tragedy. PTSD is indeed a tragedy. So, 3 regions affected by PTSD: hippocampus, memory, amygdala, emotional, regular behavior, response to stress, and problem solving, thinking, behavior, personality development. So if you look at a brain scan, PTSD, the brain is hyperactive. They just can't get over it. It looks like. So healthy brain is like that. Improve brain connectivity and memory. Yes, no, good, poor. Compare this. There's reduced connectivity and yet there's increased activity. So these are what is affected in PTSD. Different parts of the brain. So why PTSD has so many symptoms? This tells you why. There's a lot of inflammation. There's a lot of dysfunctional nerve transmission, and the mitochondria is dysregulated. Energy production is changes. Produce key fatty acids, insulin dysregulation, so blood sugar go very high because it's a high on flight. Insulin is not regulated because the blood sugar is high, and increased levels of stress hormones, the catecholamines and so forth. So these are all the changes in the brain that occur when you PTSD. Can TeraHertz be used? You might like to know that when you shine the brain, your TeraHertz can reach brain cells in the emotional brain, right in the center. Now that's very interesting. So because of the anti-anxiety, anti-depression, and the social interaction, TeraHertz can encourage nerves to generate. It can, in one research paper, they say that it stimulates hippocampus C3 region. C3 region is a part of the hippocampus that regenerate, which means that your ability to think improve. So your brain structure become normal, improve in symptoms, and it can reduce inflammation and nerve loss, and your nerve cells begin to function normally. It's amazing what TeraHertz can do. stem cells is even more amazing. People come to know that stem cells is an effective treatment for PTSD because of the successful treatment for epilepsy with stem cells. Stem cells and amygdala hippocampus key to treatment. Notice the earlier slide I showed about you in depression, how different treatment, whether drugs, psychotherapy or electrical therapy, cause increase in nerve factor, and I told you that the nerve factor is an indication the stem cell is active. So stem cells cause the amygdala and hippocampus to be normal, and therefore it's not surprising that stem cells can increase and make your amygdala and hippocampus to be normal again. So the inflammatory cascade as a result of this stress and all that, and depression, whatever, is linked to PTSD, becomes normal. And normal cells are being replaced. Cells that are missing or they have died are regenerated. It not only prevents PTSD from developing further, it reduces the severity of PTSD. In fact, now experts are saying that it's an option for treating treatment-resistant PTSD. Now that's exciting because it has much less side effects than all the medication that we're using for PTSD now, and that's, to me, is the best news. So this is healthy, this is abnormal. Healthy fear arousal, the result is consolidation of fear-based memories and fear extinction. In other words, this is normal. This enables us to face life because all the fear-based memories are consolidated and become a part of us. We know how to avoid things that give us fear. In PTSD, heightened fear, heightened arousal, decreased stem cell production, the hippocampus is not activated, cortex is also not active, so fear cannot be reduced. What happened then? Consolidation of fear-based memory, and that's what happened. This thing keep coming back again and again. I showed before. This is in epilepsy. In epileptic brain, they have successfully been able to treat it with stem cells to become normal. And so it's the same thing. The amygdala and the hippocampus is here. They take the stem cells from the embryo and they inject it into the brain and they recover. To me, this is one of the most exciting research ever done. Now we talk about burnout. This is the last topic and we will finish with that. Burnout is a state of emotional, physical and mental exhaustion by excessive prolonged stress. You find this at work, where they work on a project, they work long hours, very little rest. I saw one HR manager. She was working until almost midnight, go home, sleep about 4 to 5 hours, and she could get ready for work the next day. So this go on for a couple of months, and finally she can't take it. She got burnt out. What I did with her? I hospitalized her. So burnt out is usually associated with work or responsibility. I know somebody who died of heart attack many years ago. The wife was looking after him. So because she had to look after him, and because of his stroke and heart attack, she got to be up most of the time to attend to his needs. Eventually she got a heart attack herself and died. That's what happened. Because it's 24 hours, and because this is her husband, she attended to him, she got no time for herself, eventually she succumbed. People with burnout felt depleted, they feel used up, they feel hopeless, cynical and resentful. The key to it is that they got no time for recovery. Because there's no time for recovery, everything is adversely affected. The physical resistance also go down, and one indication that they are prone to flus and colds. And it's not just your resistance to flus and colds go down, your resistance to other things, other illness, heart attacks, cancers, anything. Your ability to fight against them is much less. So when you're under stress, you put in too much effort, you feel very strongly, you're hyperactive and anxious, and there's a physical toll on you. When you're burnt out, you can't put in any effort because you are exhausted. Your emotions are blunted. You feel helpless, you're not motivated. The toll is emotional. Stress, the toll is physical. Burnt out is like that. Exhaustion, dreading work, trouble sleeping, short-tempered. You feel like you're drowning with depression. You have no time for work-related things. So how do you manage? If severe, may require hospitalization and medical treatment. That's what I do when I was in hospital practice. But right now, if I'm not in hospital practice, what do I do? Separate from their area of responsibility. If they're nursing a sick patient at home, take time off, go somewhere, stay in a hotel, enjoy the hotel facilities or whatever. Or get away from the responsibilities at work. Take leave. Don't hear about it. They always say, but what if? And I have this to tell them. You are not a savior. You don't need to save whatever is there. Whatever is there will take care of itself somehow. You must stay away, and you must review and reorientate how you fulfill responsibility. Know that you can walk away most of the time. Even if you are there, you can't save it if it cannot be saved. If it can be saved, even if you are not there, somebody else will do it. So you are not needed. So it's important that you recover. You must listen to what your body is telling you, recognize your stress. If your body wants to sleep, listen to it, go and sleep. And a very powerful thing is meditation and mindfulness. Now at this point, I want to explain to you what mindfulness and meditation is. Many of you probably exercise. Why do you exercise? You want to be fit, right? So mindfulness is a way to live your life where you focus on the present, so that you can deal with distraction, so that you can be able to accept whatever happened. So the focus on the present is very important. And how do you get to be mindful? You learn meditation. So meditation is the same thing as exercise. It leads you to a state where you are mindful, you are mentally fit, and your mentally fit is you focus better, you can become more productive because you focus on the present. You are not distracted, and you learn to accept what comes. So normally, under normal circumstances, our mind think of everything. Normally, sit still and ask yourself, what is your mind thinking of? Focus on what you're thinking of. You find that your mind focus, oh, I have to do this. Oh, how about this? How about that? Worries about this. Can I do this better? What if something happened? So our mind is always active all the time, because it has so many things to be concerned about. But when you are mindful, you focus on the present. And the present means that whoever sits in front of you is the most important person. I learned that from my godfather. When I visited him, I said, oh, maybe you're busy, I want to go. No, you are here now, you are most important. And that is mindfulness. You focus on the present, you accept whatever happens to you. Yeah, you may think about what you're going to do tonight. You may think about what you will buy on your way home. But these are thoughts. You don't have to pay attention to it. It will sort itself out. So you learn to ignore all this distraction, focus on the present, accept that these things happen to you, accept that you can be more active if you learn to focus, and so you focus on the present. And when you do this method, you realize that all the distractions will come and go because you note them and you let go of them. So they no longer trouble you. And then you begin to tell yourself, I can take charge. And because you take charge, you can let go. And because you are mindful, you meditate techniques of calming your body. You realize that because you are able to meditate, you are able to control your body. If you can control your body, you can learn to control a lot of things. And that's how improvement comes about. So this is a slide I used to give. I used to conduct stress management workshops and courses in the past. This is a slide that we often use. The level of stress, your ability to perform. Stress too low, you can't perform. Then you reach a level of stress where you are most productive. And then you reach this point where you become distressed. Stress is too high, that's where you become stressed. Unfortunately, most of us have this desire to do the best or to please somebody, and we often end up here. When you're mindful, you are here. When you're mindful and you can focus on the present and be the better you, that's where you are functioning. If you want to do work, if you don't have to do work, you relax and you end up here. So in effect, all the things that we talk about as far as stress is concerned, obey this law. So if you are mindful, if you use meditation techniques to help yourself to focus on the present, what happens? You increase your immune function. Your body's physical health improves. That's very important. Many people forget that. Not only your physical health improves, but even if you are sick, if you are mindful, you recover better. That's the improvement. Increase awareness, improve clarity of mind, improve working memory, information procession, and increase compassion. What happened? What is lower? Your heart rate is lower, your blood pressure is lower, your anxiety, your stress, your bias, your emotionality, the way you react emotionally, all get reduced. So less stress. What's improved? Your mental health improved, your mental functioning improved, your patience improved, your productivity improved, your relationship improved, your general well-being improved. Any reason not to be mindful? No, right? If you really want to be a better person, that's what it's all about. That's the benefits. So, is your mind full of thoughts and therefore you're always distracted? Or you are mindful, where you can focus on what you want, your intention, and not on the present. So many things to distract you. Mindfulness, gratitude will lead you to accomplish great things in life. So, a balanced life making lifestyle choices. A healthy, happy mind, good healthy habits, fresh food, balanced diet, adequate exercise is a given because you have a physical body, your positive outlook, lower your stress, your loved ones, connect with people, and that's how you make your life meaningful. That's how you make stress-related illness a thing of the past. So to recap, iTeraCare can be used in inflammation, in pain, blockages, and skin. In this talk, I focus on stress and psychological response and neurological response, in other words, in our brain. In that sense, you can say that it has to do with pain, it's to do with inflammation. But they affect your body. So I don't want you all just to use TeraHertz for your skin and your various blockages or whatever, over pains and all that. A lot of this is due to the way you handle your life. You don't pay attention to the stress and to the kind of things that goes on inside your brain, which leads you to stress and all the other things. So these are not recommended in those circumstances, and I don't think I need to go through this.